doing today is talking a bit about drinking and hydration and how we prevent dehydration in older people. It specifically follows on from research in care homes, but it's also relevant to older people living independently as well. I hope you can all take something from it. Okay, so I'm going to start by just working out how to use a pen. Okay, the other way around. That's working. Okay, lovely. Sorry. And I'm going to move this just a little bit so I can see the slides at the same time, if that's okay. Wonderful. Right. I have a tendency to wander away from microphones, so if you can't hear me, can you just wave at me and make sure that you actually get back in the right place? Because I know I'm really bad at that. I forget to concentrate. Okay, so we're going to start thinking about drinking. If I come to you, you're sitting and relaxing with your cup of tea, and I say, I've got something for you. It's going to be really, really good for you. Do you think, wow, yeah, brilliant? Or do you think, ooh, oh dear, what's that? What do you think? What's your reaction? There's a bit of nervousness there, isn't there? What on earth? She's going to make me do something difficult or hard, or something that I actually might not want to do or might not choose to do. We often encourage our older residents, older people, to drink that way. So this is going to be good for you. Okay? Worthy, true, but it doesn't necessarily give us the reaction that we need. People tend to set up barriers quite often, rather than people thinking, oh great, let's go for that. They think, maybe I need to think about that, not sure. They've done some research with children, and what it suggests is that if you're trying to get them to eat more fruit and vegetables, if you tell them it's good for them, it doesn't work. If you tell them they're going to love it and it's going to be fun, and you have a game where you get slices of orange as a prize, actually it starts to work. So making it fun, making it enjoyable is a really good way of introducing something that you'd like people to do. Okay? So anyway, let's start with you. So what I'd like you to think about is a drink you had recently. Think about a drink you had recently that you really enjoyed. Imagine it in your mind's eye. Now, tell your neighbour about it for a minute. You've got 2 minutes. What about that drink made it so lovely? Okay? And it can be alcohol, I don't mind. Okay? So just talk to your neighbour a minute. Tell them, they'll tell you.
Yeah, okay. Can I move back to us all again now? So it sounds as though from the levels of discussion, it sounds as though you all thought of a drink that you enjoyed. That's great. So good, I hope you all did. So what I'd like you to tell me is, if you're willing to, put your hand up and tell me what about it made it so pleasant. Okay? What was it that made the drink so lovely? Why did you enjoy it so much? Anyone? Yeah?
I was in bed.
Oh, wonderful. A drink in bed. How gorgeous is that? Wonderful. Absolutely. Any more?
Because taste.
The taste. It was a lovely taste. It was a lovely drink. Wonderful.
Because it was hot and it made the way I like it.
Wonderful. So it's perfect for you.
Yes.
Wonderful. Yeah?
Pleasant experience.
Pleasant experience. In what sense? It was context, people? What was the...
Everything. environment, people, it was a cold day, it was warm, I love coffee, it's
Yep.
very inviting, the texture is just perfect for me as well. I'm good.
So it was a lovely drink, you really enjoyed it, it was with nice people in a nice place. Okay, wonderful. Lots of good stuff there. And anyone else?
It was almost like forbidden fruit, having a glass of wine before you go to bed. It was a little bit of a naughty side.
A treat, yeah, okay. Slightly naughty treat, wonderful. Yeah? Yeah?
Mine reminded me of childhood because it was Nesquik chocolate milk.
I remember that too.
That
Oh, how delightful, yeah, okay, wonderful. Anything else anyone wants to add to that? Lots of good reasons to enjoy drink.
I was very thirsty,
Sorry?
so I needed to drink.
Yeah, you needed to drink, you were thirsty. Yeah?
I tried a drink that I'd never had before.
Okay, so it was a new thing.
It was a really new
It was novel.
something I wouldn't have ordered if I was in a restaurant, because a friend gave it to me and suggested I try it. Actually, it was really, really nice.
Wonderful. Okay. So lots of lovely things there about drinks. They can do lots of different things, can't they? They can be just a perfect drink. They can taste lovely. They can look lovely. They can be in a lovely context with lovely people. They can remind us of things. They can just be comforting and wonderful. Okay? So drinks are wonderful. So I think we need to use some of that positive stuff, the reasons we love drinks, to help our residents drink too. Okay? So, just another question to add on to that one. If you need a wee, and you may do now, having had, well, you probably went for a wee during the break, but anyway, if you did need, if it was half an hour forward, you needed a wee, and you haven't got easy access to a toilet, and I bring you a cup of whatever and say, would you like one now? There's a bit of tension there, isn't there? So, actually, being in a place where we can't easily access the loo, if it's a bit difficult, it's uncomfortable, maybe there's a queue, actually that's going to make us hesitate about drinking. And it's a really big blocker of drinking in older people. All sorts of issues around needing the toilet and continence. Okay, so we'll come back to that too. All right, so I think we're going to talk about 4 ways, you can divide it in different ways, but I think there's probably 4 ways we need to think about how to support drinking for older people, whether this is in residential care or this is in the community. The first one is social. We're going to talk about toilet support very briefly too. There's some structural issues and some staff issues, okay? So the staff issues are assuming residential care. Let's talk about social for a beginning. So we drink, we're social beings, and we use drinking and eating to make us feel we belong to a group. It's a really kind of core issue. So we eat in families, we eat in small groups, we eat with people we trust and we like. Same with drinking. So if you think about it, drinking with friends is a really calm, lovely experience. It tends to cement a relationship, but also we tend to drink quite well in that context. Okay? So we need to think about how we use that socialising to help older people drink. Supporting them drinking together is a good way of doing it. And there's one thing that we've talked about with our hydration champions recently, which is actually sharing a drink between a carer and a resident. 1-to-1, having 10 minutes that are just to sit and talk and drink, both having a drink, is actually a really, really positive thing for the relationship. Helps older people feel that they really belong in that context. And it also makes sure your older person and your carer are well hydrated. So it actually has lots of knock-on benefits. It's not a break, it's not your staff break. It's work for them, it's core work. And actually one of the things that we found when we talked to staff was they found that a really difficult thing to do, because their perception is if they sit and do that, they think of themselves as not working, and other people think of them as not working. It looks like they're not doing their job, essentially. But actually I think it's a really core part of the job. So thinking about how you can actually move that into being a normal part of care is actually a way of transforming how both relationships, I think, within homes, making older people feel they belong, but also supporting drinking in both groups. Okay, also activities, wonderful things. Often when there's an activity, there's a drinks round comes around. A really good thing to do is to use that time, maybe to give an extra drink, but also to make sure that people are sitting and having a social time during that drinking. Support that sociability during drinking. It's a lovely thing to do with activities. And the other way that we can support drinking is to support relationships between residents drinking. So it may be that Violet and Dot are sitting next to each other, but Violet can't quite hear because it's her bad side, And Dot can't quite remember whether Violet has grandchildren or not, so she hesitates to raise the topic. And nothing happens, no conversation, no communication happens. A carer can quite easily support that, making sure they can hear each other and see each other, but also maybe supporting a bit of conversation, asking about the grandchildren, reminding each other of their names, supporting a conversation to happen during drinking time. Okay? And that drinking and conversation is really positive. And again, staff can support that very much. And it doesn't always happen, even with lots of people sitting in a room with a drink at the same time. So it's supporting it to positively happen. Okay, so that's the social aspect, which I think is key. Toilet support, I've mentioned, I think is really, really important too. So it's making sure that older people are very confident about getting to the toilet when they need to be. And we've talked to lots of older adults about drinking, and they tell us very clearly that they decide not to drink very often. They decide not to drink because they're worried they'll be a burden, because when they do drink, they'll need to go to the toilet more often, and they really worry about that they're going to have to use carers harder. And they choose not to drink because they're worried about the consequences of perhaps not being able to get to the toilet quickly enough, having an accident in the day room. How embarrassing would that be? Intensely embarrassing. I would not want to be in that situation. Lots of older people don't, and they actually cut down on drinking to make sure that actually they won't need to go that bad. So excellent toilet support every time can allow older adults to choose to drink more. And what carers tell us is the way to do that is be proactive about getting to the toilet. So actually realising that a resident has a pattern of maybe needing to go every hour and a half, or maybe needing to go half an hour after a drink, or whatever that pattern is before a meal. And rather than waiting till they call, when you've got a moment, go and ask them if they'd like to go now. Actually getting ahead can really help people feel confident about how that works. Okay, so social, toilet, important. Structural issues. There are some structural issues about how we run. This is particularly about residential care, but I think it would work in old people's homes as well. How we work to provide plenty of drinks that the older person really enjoys. So a series of stuff here, and forgive the list. So making sure every older resident is presented with a drink they like, enough drinks in the day to give them enough fluid is really important. So it's wonderful having jugs of water and jugs of squash around. It's really good to encourage residents to help themselves to those, but you can't rely on that for their core amount of fluid, okay? So it's making sure every resident is offered enough. And we'll talk about how much enough is in a minute. Bringing an early morning drink every morning. So most care homes do early morning drinks between waking and breakfast. Often there's quite a long gap for some residents. But residents tell us it happens sometimes depending on who's on shift, okay? So often it's missed. And that's an important one because residents have gone a long time overnight without drinking. That first drink can be a really crucial one, and one that they really enjoy actually. Maybe like that drink in bed that we heard about a little bit earlier. A really nice occasion to have a first drink. Lots of drinks at breakfast, so giving plenty of fluids in the morning is really helpful. So making sure that maybe at breakfast they have a fruit juice and 2 hot drinks, 2 coffees, 2 teas, whatever it is they like, is a really good way of helping people have plenty in a situation where they can then relax, again, socialise a little bit and drink plenty. Offering drinks more often, again, at least twice during the morning. I know it's usual to have a drinks round in the morning. I've certainly been to several care homes where they have 2 drinks rounds in the morning. And my experience of the care homes where they have 2 drinks rounds in the morning is that residents tend to be better hydrated. Residents are more likely to drink in the morning than they are later in the day. So again, encouraging the morning drinking is really good. Offering refills and second drinks at every mealtime. So again, having that thing where you have a drink during your meal, and then it's a common practice to sit and have a chat and a drink of coffee or tea or whatever it is people like after a meal. To relax after a meal is really positive. Again, very good for social, very good for drinking. Giving a good big drink with pills. So what you give with pills can be water, could be things like orange juice. A good big drink helps make sure pills go down really well, which is great. And it also makes sure you're getting a little bit of extra fluid into people. When removing an unfinished drink, always offer a replacement, getting the thickener just right, finding a drink that this resident loves. So we talked about how much people love particular drinks. That's really important. Let's know what people love, how they like their drinks. Anyone got a favourite cup ever?
Yeah.
Your resident may do too. they might really enjoy drinking out of that cup. So we need to make sure that happens too. And helping the resident be independent with drinks. So again, if they can make themselves a cup of tea, support them to do that, or encourage them to do that. If they can get themselves a glass of squash and want to, again, encourage them with that, that's great stuff. And offer a choice every time. And sometimes a new drink. We heard something about new drinks being interesting and exciting. So maybe have a trolley, and in the afternoons you have your standard drinks on there. But every afternoon you have an exciting new drink. Maybe it's a fruit tea today, or maybe it's Nesquik, or whatever. You know, choose something interesting. Have a variety. Let residents look forward to that. And not everybody will want it. Some people will only ever want tea, and that's fine. But some people will drink a lot better because there's something interesting and new there. I look forward to that. And just to say it, because I haven't explicitly said it, fluid is what we're looking for. So it doesn't have to be cold water. You can be well hydrated without ever drinking a glass of cold water. So you can drink tea, coffee, cola, fruit juice, milk, squash, soup, beer, lager, shandy, water. All of those are hydrating. All of those are great. So use any of those that your residents enjoy. Okay. There's the structural issues. Final one is your staff. Staff, we all work better when we're well hydrated. So staff need to drink well themselves to be efficient, to be good at their jobs. But it's also, if your staff are drinking well, they're better able to support your residents drinking well. They understand it. Yeah, and again, that takes me back to that issue, the idea that we might get our staff to sit and have a drink for 10 minutes individually with a resident. And that again helps your staff drink well, it helps your residents drink well. Okay. And to get all that happening, it's really useful to have hydration champions to drive and support the changes. So we've been looking at how to do that with hydration training. We've worked with some of your homes to do that, and I think it's a really positive way forward. So hydration champions can bring in these sorts of changes, can try them out, can talk to staff about how we run them, talk to residents about how they find them, find the right way for your home to work, so it all comes together. Okay, so that's the most crucial stuff. Any questions about that? Any comments? Okay, I'll plug on. Got another 10 minutes or so, but shout if you want to talk about anything, not a problem. Okay, so again about you. How do you know when you need a drink? When you've not drunk enough? First, yeah?
Headache.
Cup of tea. You wee and it goes all funny, okay. Dark wee. Feeling thirsty. Anything else?
A headache.
Headache, yeah, absolutely.
Concentration goes.
Oh yeah, that's mine too. I just can't. I find I'm dithering around. Yeah, absolutely, totally. Anything else?
Dry lips. Dry lips.
Dry lips, yeah, that's a nice one. Okay. Anything else? Okay. Tired, yeah, absolutely. So some of you are feeling thirsty and some of you are not in that. That's really quite interesting. So the way it works in children is they should get thirsty before any of those other symptoms happen. Okay? So we're constitutionally set up so we feel thirsty if we're not drinking enough. So we drink more, so it all sorts itself out. But as we get older, we stop getting that thirst sensation. So I'm too old now. I'm 58, I don't get thirsty anymore. So I get to the point of losing concentration and getting a bit headachy before I feel thirsty. And that's not the way round it should be. But that's true in most older people as well. So older people lose their sense of thirst. And that means several things. It means that we can't rely on thirst to tell us when we need to drink. So we need to think about things like routines, so it's 11 o'clock, cup of coffee or whatever. And many older adults think they're drinking enough because they're not feeling thirsty. They're assuming they're okay because they don't have a sensation that tells them they're not. So that's a problem too, that we need to talk about a little bit so older people understand that the fact they're not feeling thirsty doesn't necessarily mean they're drinking enough. How much do old people need to drink each day?
It depends on the person.
The research behind this is not very good. Let me admit this now. Okay, but what we have got is European standards for how much people should be drinking. That's adults, both men and women. Anyone know what those might be?
Around 1,800 to 2 litres.
1,800 to 2 litres?
2 litres.
Yeah, 2 litres. Anyone else?
It depends with how much somebody drinks is dependent on their weight. You have to multiply each kg by 30 something to get the exact.
Okay, so we do that sometimes in hospital, absolutely, when we're looking at fluid requirements. Yeah, absolutely. So the European suggestions are these, that men need to drink at least 2 litres, that's about 3.5 pints if you go in the old measures, every day, in addition to fluid from food. So we get some fluid from foods as well. And women need to drink at least 1.6 litres, that's about 3 pints each day. Okay? So that's the recommendation. That's not weight dependent, and I know that some calculations do use weight. The honest truth is, we don't have very good evidence for using weight or not. Okay? It may be sensible to drink a bit more if you're heavier, but we don't know that. But the distinction between men and women is probably based on the fact that men tend to be a little bit big. They have more muscle mass, and therefore they probably need to drink a bit more. Okay? So that's the recommendations, and that's probably that's what you're aiming for in terms of your own drinking, but that's also what your residents are aiming for, or what you're aiming for your residents, if you want to put it that way. So given that we want a man to drink about 2 litres a day, how many of those is he going to need to drink in a day to get enough? 10?
About 20.
20?
No, it's 150 minutes.
It's about 150 mils, isn't it?
Yeah.
So how many drinks would that be?
Well,
15.
Good maths. 150 mils, about 14 of those every day. So between 10 and 20 was exactly where we were. Well done. And women need to drink about 11 of those every day. So if in your setting you're using cups of that sort of size, then that's the number of drinks you need to be providing your residents every day. Okay? Quite a lot. If we go up in size a little bit, so we go to this sort of mug, this is about 250 mils. It's a bit fewer. We can go for 8 in men and 7 in women. We'll do it. But just remember, some people will actually drink better if you give them smaller quantities. It doesn't always work better to give them a bigger cup. Works well for some people, other people it puts them off. So you need a bit of balance with that. Okay? But I'm just reminding you how many drinks that is, because actually sometimes you find if you look at the cups you're using and the number of drinks rounds you do, that actually you're not hitting the 2 litres for men, or sometimes even the 1.6 for women in your standard provision, and you really should be hitting that. Okay, so what do you think? What proportion of older people living in residential care are dehydrated? 70%? It's not that high, it's all right. 30%, yeah? Any other ideas?
it's just a statistic.
It's statistic. So what we found, we did some work a couple of years ago in some of your homes, Norfolk and Suffolk, through Norfolk and Suffolk. And what we found across the care homes we worked in, it was over 50 homes, we found that 1 in every 5 of the residents we interviewed, on the days we interviewed them, were actually dehydrated that day. Okay? So it's a high number. It's probably higher with older people living at home who need care, because they're not provided with the same routine in the same way that you get that in a care home. So it's probably higher, but we don't know that. We haven't got good data on that. It's just a supposition. Okay? And if you're looking at people who have dementia, the numbers go up. So it's actually... Going the wrong way? Oh, why is it? Sorry. As we get older, we stop feeling thirsty, as we talked about. We begin to reduce our social contacts. We worry about going to the loo. Drinking can be physically difficult. So drinking needs to be prompted by routine and enjoyment. So things we've talked about already. But sorry, just to get ahead of myself on the slides. So those with dementia, it's about 1 in 3. Okay? And that's because in addition to all those issues, those with dementia don't remember whether they've had a drink already often. So they won't know whether they need one. Begin to lose their routine, and that loss of routine is really important in drinking less. Lose more social contacts. And again, we've talked about when we see somebody, we often say, oh, come and have a cup of coffee. If you're not seeing other people so much, you drink less. Still worry about toilets and continence, and may forget what to do when dementia becomes extreme, may forget what to do with a cup of tea or coffee. So a cup of tea or coffee doesn't prompt you to drink it anymore, it doesn't make that connection. So more common, and the evidence suggests that as dementia gets more severe, the risk of dehydration gets greater. Okay? But it starts quite early in dementia. this is just a very, very quick summary of what dehydration is, but there's two sorts of dehydration. We've been talking about the one on the left-hand side, called low intake dehydration. It's about not drinking enough. It's actually quite different from water and salt loss dehydration, which is the sort of dehydration you get when you get diarrhea and vomiting. Okay? They're different because they affect your body differently. The fluid comes from different places in your body in the two sorts. So what you find when you're not drinking enough is the fluid comes from inside your cells. And some people mentioned the sort of impact they get from not drinking enough is you get a bit headachy, a bit tired, stop being quite so organised. Those are all brain effects of your brain cells shrinking a little bit. Okay? So actually that's what you get with not drinking enough. When you have fluid loss, what happens in diarrhea and vomiting is you lose fluid, but you also lose electrolytes that you don't lose when you're simply not drinking enough. Is that the fluid comes from your external fluid, so it's from your blood compartment, if you like, rather than from inside your cells. And that means you have different effects. So you may get dizzy as you stand up, your blood pressure starts to go, but you don't have the same brain effects necessarily. So two separate things. Low intake is about drinking, water and salt loss is about being ill. And doctors are much more aware of the one on the right-hand side, but the one on the left is much more common and has serious effects. Okay? So what are the effects on you if you don't drink enough? People have said a bit less organised, have said feeling thirsty, said a bit headachy. Anything else? If you don't drink enough, how do you feel?
Tired.
Tired, yeah, absolutely. Constipated, oh, that's a good one. Absolutely. Important one, isn't it? Mm. It doesn't sound like an important thing, but it's horrible, isn't it? No fun at all. Yeah? Sorry, I'll talk about toilets all day, so. Okay. So yeah, those are the sorts of effects we have if we don't drink enough. It's not awful, but it's not great either. In older people, what happens if they don't drink enough? Falls. Anything else? Confusion, yeah.
Water infections.
Yeah.
Urine tract infections. Constipation.
Breakdown in skin.
Oh yeah, skin problems, absolutely. Anything else? The list is actually really... Sorry?
Blood imbalances.
Yeah, all sorts of things, absolutely. So the list is actually really quite long here. Urinary tract infections, other infections. So just to say, one of the effects of not drinking enough is your whole protective system doesn't work as well. So it takes you longer to get rid of infections. You're more likely to get infections. Not just urinary tract infections, but all sorts of infections. So there's very good evidence that lower respiratory tract infections are more severe, more likely to cause harm if you're not drinking enough. Okay? So all sorts of infections. Falls, fractures, confusion, delirium, pressure ulcers, lots of those you've mentioned, well done. Poor wound healing, constipation, kidney stones, renal failure, heat stress, stroke and myocardial infarction, both more likely as your blood gets slightly more concentrated, drug toxicity, decreased function, and increasing disability. So one of the interesting ones is increased risk of disability. This is particularly, I think, for older people living at home still. If they're not drinking enough, their risk of disability in the next few years goes up quite a lot. Okay. So to summarise, preventing dehydration by increasing drinking probably reduces hospital admissions and reduces illnesses dealt with by care home staff. So it's more work to help your residents drink well, but it probably saves you work the other side of the equation too. Preventing dehydration reduces care home and NHS costs, we think, but we haven't got very good evidence of that yet. We have some, but not perfect evidence. Okay, we've done lots of research in care homes. If we've worked in your home, thank you so much. Really, really appreciate it. I haven't talked about the research per se, I've talked about the findings of those research. I hope that's okay. And I just want to say thank you to Diane and Florence, who some of you may know, again, who may have worked in your homes as part of some of these projects. But thank you to you and your residents if you've worked with us. And if we contact you in the future, please work with us. We're lovely. And we very much appreciate your help. So thank you. Okay.